All right. My name is Betsy Cunningham, and I'm the chairperson of the board of directors of Housing First Umpqua, and one of the founders, along with my co-conspirator Martha Bryson, who's on the board in the meeting right now. You see who you see in the background is a gentleman who passed away in 2016, I believe. His name is Jim Clymer. And he actually is the person that you see on our Facebook page and kind of reminds us why we are here. And I think Jim exemplified the kinds of gaps in the system because he passed away in Newton Creek while he was waiting to try to get alcohol rehab in the community. So I think that's what we're talking about tonight is the idea of what kind of homeless services there are, and not just homeless services directly, but mental health, substance abuse treatment, and a variety of other services that may be available to folks. And although we have some presentation of some information, we're really more interested in having a dialogue with folks who have been involved in the situation, either because they themselves have been homeless, they know someone who's been homeless, or just a community member concerned about the issue, or they have some kind of professional interest in it. The person who was going to talk primarily about the alcohol and drug treatment and mental health issues is one of our volunteers who couldn't make it tonight. And so one of the primary focus we're going to probably talk about is the homeless services. And when we look at homeless services or we think of homeless services, I'm really talking about the services, not necessarily the basic need kind of services, but the services that are really aimed at getting someone housed. So on the call tonight, luckily we have Mike Feldman, who's the former executive director of UCAN, because one of the biggest service providers that receives money, and there's a variety of ways that happens, but the big one is the continuum of care, which looks at, and what we're really going to talk about most specifically is not the large group of homeless folks, but those folks who are chronically homeless. The ones that UCAN representative recently told the city council provide a lot of the problems that people see are part of, the things that people complain about. And they're the ones that are least likely to get serviced and ultimately housed permanently from our homeless service dollars. So the HUD, the U.S. Department of Housing and Urban Development, creates a system of funding and then designated units are called continuum of care. And it's money for homeless services, and here the provider is UCAN, but they're actually a part of what they call the Oregon Balance of the State, COC, and you can see where that gray arrow is. That's where we are, and it's a huge part of the state that meanders all the way through the state, and it looks like to be more rural areas. So, so we're looking at that as a piece of what we're talking about with homeless services, and specifically what we're going to look at is what UCAN. This is from. I believe the presentation they made to the city council about the type of services that they provide to folks in the community. And we're looking at, it's very hard to see because we couldn't screenshot this any more clearly, sorry, but there are various programs and funding. Services depend upon a variety of factors, the program criteria, sometimes they just serve special populations. HUD has a vulnerability index. A barrier is actually access to housing options and the ability of the person who is homeless to access housing and other services on their own and stay engaged within the process of getting. And then ultimately, the reality is even if we did everything perfectly in everything above, there still isn't sufficient funding to address the issue of homelessness. And I don't know if Mike Feldman, I don't want to put you on the spot, but if you would like to, step in and share, that'd be
Um,
great.
yeah, no, I think Betsy, you covered it well, especially the last part that there's insufficient funding to really meet the need. I think the only other thing I'd just like to maybe add on to a little bit is that being part of the balance estate, such a large entity, and I think it's like 20 some counties, if I remember correctly. It's been a while since it's been almost a year since I've really been dealing with it. And given the HUD's requirements for submitting funding applications, it makes it really challenging to meet all the HUD funding requirements, application requirements for putting together a consolidated plan and a consolidated application that covers 20 counties and that is supposedly supposed to have common goals and directions and plans and everything else. So it really is a challenging model for HUD to work with. And I think some of the challenges that we have locally really come from a HUD funding model that really wasn't made for rural areas and with large, vast geographic areas like we have in Oregon. And so that's a sort of an extra layer of problem that exists with the continuum of care applications and process. So that's the only thing I wanted to add.
Well, what is the solution for that?
HUD has to change its policies and direction. That's a federal, that would probably have to require federal legislation, I would suspect. I'm not an expert in that area. So that's, just know that it is one of the confounding issues to it. HUD's not real rural centric. It's in their name, housing and urban development. They have a very urban focus in how they run things and coordinate things.
And do these rural communities that are part of this, do they have an idea of what they think should be done differently?
I don't know. The other thing that has changed recently, and I think it's probably going to be for the better, is that the administration of it all and the coordination of it was consolidated a year and a half, 2 years ago, maybe now, with the Community Action Partnership of Oregon, or CAPO. And for years, there was basically one contracted staff person doing all of the continuum of care work for all 20 some counties. It was way too much for one person, but that's all we had funding for, because HUD does not fund the continuum of care process very well, if at all. OHCS wasn't putting any real money into it, very much money into it. And so there really was a lack of resources to be able to operate it. And so that has changed recently. So there's actually more staff involved, and so since CAPO's taken it on, and so I'm guardedly optimistic that it will make things more manageable for the continuum of care process by having them. But as far as what really needs to be done to change, those questions would probably be best directed at the Community Action Partnership of Oregon.
Well, when I heard the presentation that was made at the recent Roseburg City Council workshop, one of the things that seemed to indicate, that I found pretty interesting, or I guess disconcerting, is the infographics, and I apologize we couldn't capture these, you know, really good enough to see clearly, but the two big numbers are that UCAN in Roseburg, and we're kind of talking about the majority of homeless who are particularly chronically homeless, or all of them really are in Roseburg. But you see the totals of services of 525 individuals, 350 of them in Roseburg, 257 households, 183 of them in Roseburg. And then to me, the most startling statistic was the fact that only 28 chronically homeless or 23 chronically homeless people were served in by UCAN. And I can't see from here the dates, but I'm assuming it was whatever the last annual cycle of service was for that. And so to me, I find if we're looking at trying to solve chronic homelessness, because that's what people are really complaining about, and complaining about are folks who are chronically homeless. Given the numbers of being a couple of hundred, I think that was estimated in the last point in time count, that we're not even really our main homeless service agency that actually does something to get people off the street or gets funding to do that, doesn't seem to be serving very many chronically homeless folks.
Yeah, yeah, and I think that's a legitimate issue. I can't respond or react to those numbers because I'm not there anymore, and I can't and don't want. I don't think it's appropriate for me to talk.
Yeah, no, yeah.
And so, but I think just working from the assumption that that's accurate and those are correct numbers. I would concur that we need to do a better job in our community in really addressing services to the chronic homeless. And to me, that's why at the city council meeting, the issue I was really pushing for and brought up several times in my presentation was the need for a committee or a commission or a committee at the city level to really coordinate the homeless services in our county, in our community. Because I think this can be indicative of an agency not doing its job, but to me, it's more indicative of the community not doing its job. And so, I think yes, you can get services for chronically homeless, but they get certain services. There's other agencies that get other funding to do other kinds of services, and other agencies that do other kinds of services. And so we have health services, we have mental health services, we have behavioral health services, and UCAN has the housing services and the case management services. And there has never really been a really good coordinated effort between all the agencies saying, okay, let's identify the people we're going to work with. Now, there is the impact program that has been started with the through the LIPSIC program, and there's some funding that has been focused towards there, and that's really sort of the first coordinated effort that I've seen. But even that one doesn't really include all the partners and all the players that who should be at the table. So my hope is by having the city have a commission, have a committee, and bringing all those players to the table and saying, here, you guys get together, figure this out. I'm hoping that will drive that coordination. On that impact thing, I just read yesterday, I think it was, that the funding, they were waiting for the funding on that to be allocated. And I just got an email that said that the funding was approved for that and for all the different communities, and Douglas County was listed in it. And if I remember correctly, don't quote me on it, but I think it was like 1.3 million. So at least that. And so it was a significant funding for that impact program, which is specifically aimed at the high utilizers of services. So so that I think is maybe some positive news. When that's going to all hit, I don't know. But that'll go to ADAPT, I think, or to the county, one of the two.
Well, I think that the one problem with the LIPSIC, if folks don't know, is the Local Public Safety Coordinating Council, and each county has one for its primary purpose is to deal with recidivism. It is to deal with folks coming out of jail or the prison system. And so the services are only available for those folks who will, are coming out of incarceration. So it does not help people who have not committed a crime sufficient to land them in jail. And that's true with what is called the RSAT, the Residential Substance Abuse Treatment. That is only for people who start that program inside jail and then come out, and then they're given some kind of housing subsidy for a while. So, and I think that that's where you see the gaps or the fall, people falling through the cracks if they don't have, we focus so much right now on incarceration and in folks who are coming out of incarceration that, or even something like the sobering center, as opposed to actually doing something that's going to substantially address the problem, like building housing and increase those homeless the services to folks on the mental health side and on the substance abuse side. So does anybody else have a comment, want to say something? You're welcome to join in.
Looks like Martha wants to speak. Go ahead and unmute yourself.
There you go. I've been looking at, since the Reagan era, they have been cutting funding and public housing funding more and more and more by the billions every decade. And states have also followed suit in not together. We're all bitching about not having enough affordable housing, and we've changed the definition of what affordable is, but it really is, we have to focus on getting more funding on a federal and a state level. Seriously, we really, that has to be part of the solution.
So I have a question. Mike, you were talking about how it's really more of like a community-led effort that will have the most impact and bring about the most change. Are you talking about how the funds we get are distributed, or can you elaborate any more on that? What you mean by that?
Yeah, what I meant by it was how the funds ultimately get utilized and how they, coordinating the efforts. Because unfortunately, the funding comes down in these silos for various issues, based on various issues and various needs. And so people tend to treat an individual they look at an individual based upon the silo that they're in. And so somebody getting mental health funds looks at people from the mental health perspective. Somebody with drug and alcohol looks at them from the drug and alcohol issue. Somebody, who's dealing with them in the emergency room looks at them from a medical perspective. UCAN looks at them from a housing perspective. And so the reality is the person's an individual with multiple needs. And so, to me, it's trying to figure out, okay, and other people look at it, like Betsy said, people coming in out of the jails. And so the funding comes down that way. And so to me, the coordination needs to happen in how those funds get utilized. So yeah, so if somebody's coming in out of the jails, then we use the RSAT, or not the RSAT, the justice reinvestment dollars for them, and support them. And if they need some extra supports, then whatever agency has those support dollars, put it in towards them. Another person whose main issue is mental health, and the mental health dollars takes the lead, and other people back in. But that takes a coordinated effort from all the different agencies sitting around the table and saying, okay, here's the guy we got, here's the people or the woman we have, here's the people we have. How can we best serve them to move them out? And what's missing? What are the things that we need to provide for them we don't have in the community? And then collectively figuring out how do we get that, rather than waiting for any individual agency to take the lead on something that may or may not be in their bailiwick when they're looking at filling needs. So it's that coordinated effort that I was thinking of.
Thank you for that. I do have a follow-up question to that one. Is there currently, and I want to hear more about the services we have, but is there currently any sort of coordination between the different services?
Informal, nothing real formal. The closest we've gotten was H-Tag, and that's more of an informal one. That's why I think that it really does call for the city to have a commission, a committee, because that formalizes it. Because if the city is saying, hey, you guys, you need to come up with a plan, you need to work together, it tends to bring people to the table more.
Yeah, and that's exactly why HFU exists. Housing First Umpqua saw that need to kind of, have that coordination and that, the ability to have someone help navigate through all these different services, because it does seem like there is such a lack of coordination. Yeah.
Right.
Thank you for that.
Yeah.
And I think, and thanks for bringing that. It kind of leads into what we have seen, and informally, Martha and I have helped, 5 or 6 years, the folks who were homeless here in downtown Roseburg primarily, or all over Roseburg when Martha was here. But as we saw this, not only that lack of coordination, which is really, really very hard for someone who is homeless, particularly chronically homeless, but we also saw these access barrier that these agencies have. And recently, in the last month or so, I had a conversation with someone in the mental health, or the medical field, actually coordinating medical and mental health services, and talking about having a medical provider, mental health providers who are the same people that go out to the people on the streets who are chronically homeless, as opposed to waiting for someone to get them there. And in my own experience in the last year of having tried to help somebody who was medically fragile, it was very, very challenging when someone's living on the street to be able to even address medical issues that are life-threatening. And so I think that it's the service delivery and the lack of coordination. I mean, they're both service delivery, but one really is aimed at how that person access services. And there are a lot of institutional barriers here that really put barriers and make life a bit tougher for someone who's homeless. And I'll give, an example is, because I hear this all the time, even talked today when we were doing some outreaches, somebody lost their food stamp or SNAP card. Well, we tell them to go to the office to get it because the law allows the local DHS office to issue the food stamp card right there. But instead of doing that, they will often tell people who are homeless, you have to call this number and have it mailed to you. But when they go in there with an advocate like me, I can get them to do what the law actually says they can do. They should be doing that without somebody like me having to be there to solve that problem for someone.
Yeah, absolutely.
So, so that's an institutional barrier. So we need to look at that side too. But what I just put up on the screen is existing services and resources. This was from last year's, the city's homeless survey or study. And this was from, the data that was collected for that. And that was spring of this last year. And so you can see this is a limit. Roseburg Rescue Mission, not only is it faith-based, but there are many people that get banned for that for a variety of reasons. There are people who won't stay there for a variety of reasons. Some are disability related. We have the Samaritan Inn, that's the women's shelter for the rescue mission. The Dream Center, Warming Center is only during the winter. And it has to be below 30 degrees or I think 32 in snow or something.
And pardon the interruption, but when you say that people can't really stay at the rescue mission for, they get banned for like religious or, sorts of things, what can you elaborate on that? Do you mean to say that they actually turn people away because they're breaking the rules?
Yes, and one story we heard today is somebody said he went around the corner and he was smoking a cigarette and somebody thought it was marijuana, and they told him he had to take a UA and he wouldn't take a UA, and so he can't come to the rescue mission.
Wow, that is a significant barrier. It, I
Well,
seem to recall something like, you know, that causing deaths, like with Jim.
well, thank you for bringing that up, because actually when Jim passed away, he was on a 90-day ban from the rescue mission because somebody had smelled alcohol on his breath. And Jim was an alcoholic. And that's what he was trying to get to adapt in an inpatient bed. But he was sleeping outside because, and he would comply with everything else. And he wasn't, from what everybody says, he was not an argumentative drunk. He was, you know, he didn't cause problems. They just have this, you know, if you smell like alcohol, you can't come here. And it was a repeat offense for Jim. And so it was, instead of 30 days, it was 90 days.
How
So,
tragic and preventable.
right. And so, you know, the rescue mission has its place for certain people, you know, I'm sure, and that fit in there, but it's really not a place where a significant number of our chronically homeless go, even in very bad weather. So then we have the battered persons advocacy that, you know, I would assume is self-explanatory, that they have some limited resources for beds. So it says 10 rooms. And then
By
we
the way,
have,
the Peace at Home Advocacy Center now.
oh, yes, yes. Thank you, Mike. Yes, they changed their name. Um, and then you have Crestview Terrace, and, you know, Mike, you could probably tell more about that than I could.
Yeah, Crestview Terrace is it's for just like it says, it's for 7 beds for men, for 3 or 5 for women, and actually it's transitional housing, and it is for previously incarcerated. So that was the
Okay.
fund. That was the funding for that. Came portion of it funding came from the Justice Department for it, and it really was the first subsidized affordable housing that was specifically for previously incarcerated in our community.
Yeah, okay, thanks. Oxford houses, the folks have to have an income to be able to live at Oxford houses, because it is kind of a communal responsibility for the rent. And it's clean and sober living, and you know it's a benefit for some people, but you can see the beds are limited. Those are also transitional housing, and I think thanks for pointing that out, because they show the rescue mission here as transitional housing, and it looks like that they break down their beds to what would be emergency shelter versus transitional, more long term. So if somebody joins the rescue mission program, then they become part of a more permanent or transitional resident, I guess. So these are just in shelter. And then True North Ministries, I believe that's a clean and sober living, faith-based. I think they deal a lot, like I said, male RSAT. Those are people coming out of incarceration from drugs, drug use. And Orchard Knoll is run by the Housing Authority. It is alcohol and drug-free environment. And like it said, they have about a 4-month waiting list, but you also have to have income to live there. So some of the problems that we see is about half of the people we run into have no income at all. It makes it incredibly hard to get them sheltered. And then Casa de Berlin, I don't know if we all heard that this week they indicated that they're now kind of closed down, trying to regroup. So we don't even have Casa de Berlin youth shelter anymore right now. And then we have Safe Haven that has been around for decades. And so you see that's very limited. And then they're going to affordable housing, and it really wasn't my intent to go through all the affordable housing, but it was on the same page, and that's the easiest way to cut and paste it. These services that we looked at. So one of the things we wanted to talk about is drug and alcohol treatment, and Compass behavioral health. And because those are a lot of things that fall into the people that we see that are actually living on the street. So let's see.
It's, even if we can get folks set up with with supportive services to get into transitional housing, after their stay is there, like at Orchard Knoll, they don't have, we don't have enough affordable housing, and we're not building and funding affordable housing for people on fixed incomes, on SSI, even if they get into transitional housing, these programs time out, and there's no place for them to go except return to the street oftentimes.
And weren't you guys saying they also don't follow up after they've left those places? They don't really follow up with them to see if they're doing okay or if they're back on the streets.
Well, they're not even collecting data like at Orchard Knoll as to what long-term benefit that transitional housing has. You know, so I don't know if there's any long-term studies with the homeless services that UCAN does, but I think it's very difficult, you know, to staff trying to track somebody. And that was, you know, the reason that Orchard Knoll indicated, you know, the time and staff to just try to track somebody that has been homeless for a year. And Mike, you now work as a legislative assistant for Gary Leaf, right?
Correct.
So what is on the horizon for what Martha brought up as far as addressing that at the state level?
Adjusting what?
The funding, like funding for housing units,
Okay.
you know.
Well, actually, there's been, at the state level, there's been a significant commitment to funding for affordable housing. Over the last 2 biennium, there's probably been over $100 million put into funds for affordable housing. But unfortunately, it takes, you know, from the time the money gets passed to the time somebody moves in to an apartment, you're looking at, you know, 3, 4, sometimes 5 years for that to happen. So it's a long time frame. There's some programs like the LIFT program that's intended to be a little quicker, but it's still 2.5 years from the time you know, money gets available to the time someone's going to move into something. So it's really, you know, it's not a quick solution by any means. And so, you know, and then you have to have the developers in the community who are capable and able to do that. NeighborWorks Umpqua is, of course, building the 60-some unit complex on Douglas Street now, which is, you know, going to hopefully be housing people sometime next year. It has a veteran preference, but it's going to be open to anybody. So, you know, that's going to help. There is like 140 or 160 unit complex being built, apartment complex being built out on Diamond Lake. And that's going up now, but that's a private developer, and I think that's just marketplace housing. But the ripple effect of that could be positive in that, you know, it will allow people to move from, you know, housing of rentals that they may not like now and move into something new that might actually open up then more rentals. So, you know, that's a little bit of bright light on the horizon, but I totally agree. I mean, the study that the city did, and I can't remember the numbers, but it looked at the number of units we were short for rentals and housing, and it was, you know, over 1,000. So, you know, we're just starting to dent it. But that is a big problem. There just simply isn't enough housing for us. There's going to be a real challenge with the budget. The shortfall that's going to happen in this next session. It's going to be a real challenge to maintain funding for many of the services that we're having. I'm glad I'm not the legislator in this going into this next session, because it's going to be a tough one. One thing though I did hear today that I was in on a meeting dealing with healthcare, Medicaid costs and healthcare, and looking at the reductions in funding and how to address that, and looking at things, you know, differently. How can we do things differently to continue to provide services? and I learned something that I guess I should have known, but I didn't, that I think impacts all this too, is that when you look at the uh, where the funding for healthcare goes in general, including Medicaid, vast majority, 40 to 50% of it goes to hospitals. The next highest percentage, like 16, 20%, goes to prescription. Then the next one is specialty cares. And then after that, it gets down to services that are the types of services that would are for primary care, and for then at the very top is behavioral health, and the smallest percentage. And the presenters were saying years ago that pyramid, the forms of pyramid really, that pyramid was flipped around. That the largest amount of funding went to primary care, when the smaller went to hospitals and the prescriptions. And they're saying we need to get back to that. And they were talking about also the need to integrate what you were talking about, Betsy, the need to integrate primary care with behavioral health, and just and really have those two together. And going into the next session, not to cut behavioral health, which is always sort of the first, what place people go to when there's a need to cut in the healthcare system is a cut behavioral health. That really what we need to do is to go to a value-based way of providing funding, instead of the the way people get paid now, which is by uh, by contact with a client, and to really shift that pyramid around and get more into primary care and behavioral health. And that would have a real impact on the population that you're talking about, if more funding could be put into behavioral health.
Well, one of the things that I think recent events, particularly the tragic passing of Tasia May, illustrates is the need for some folks to have very intensive long-term support systems in place. That what we have seen, and this is just anecdotal certainly, that people may be engaged with the system even like because of incarceration for drugs, and I'm not speaking of her, but get in the system. They're in there 18 months or whatever, they have supervision and they may be okay, but once that support system is gone, then we see them back on the street. In months you see them back on the street.
Yeah.
And so I would think that kind of funding, how do you convince the people who make these funding decisions how critical that is?
Yeah, I agree with you. I think there is a population that needs that long-term care on it, and I think part of it is what they're looking at with that primate with healthcare is going to a value-based form of funding healthcare, where you provide a flat dollar amount, a fixed dollar amount to the CCOs to provide a certain, the appropriate level of care to all the people in your community, and that you can spend that money however you need to get the outcomes that you need. And where places where they have done that, it's been very successful. But right now, it's based on encounters. Every time you meet somebody, have an appointment with somebody, you get paid based upon that encounter. And only certain encounters get paid. Other encounters don't get paid. And so until we can change that funding model, which I think there's a lot of movement to do that. I think COVID has really increased that direct movement in that direction, because the hospitals and the healthcare systems that were on the value-based funding, they've weathered the financial impact of COVID on the healthcare system much better, because they have a fixed amount. It didn't matter whether people were coming or not coming in. The ones who were based upon the encounter basis, they were struggling. And so I think people are seeing the value to the encounter-based model. And if you had that, then you could go to your local people and say, hey, here's what's missing. Here's what we need. We need to put the money into it. So I think that's one option. Well, the other thing
Well, go
I just
ahead.
want to share with you too is that, I mean, I just want to agree that we need a low barrier shelter in this community. You know, the mission is a high barrier shelter. We need a low barrier shelter. And that's one of the things I've been working on with Representative Leaf, is to try and bring the funding in for a navigation center, which would include a low barrier shelter. The Speaker of the House actually had, in the last short session, had a bill and introduced that would have provided funding to local communities for creation of navigation centers. And I put in a request to the speaker to be included in that list. And then the short session didn't finish and didn't happen. And then COVID happened and the budget got blown up. And so rather there's still going to be money for that, I don't know. The speaker did, in the special session, did get the language of that bill included in the piece of legislation in the special session, but no money for it. My hope is that maybe in the next special session, she's going to bring bring the financial piece of it into it. And so we've been in touch with her that we would like to be considered for part of it. And, you know, I had a rather substantial ask in there of over $2 million to make that happen. But whether it will or not, I don't know. It's the budget is a very precarious position right now. So, but I think that's one of the things we need. We need a navigation center, engagement center, whatever you want to call it, and then a low barrier shelter. I mean, I think that would really go a long way to filling some of the gaps we have in services right now.
Well, and I think you need some of those navigators or advocates or whatever you might want to call them.
Absolutely.
And because, you know, that's really the main focus of what Housing First Umpqua does, is trying to help people figure out, you know, addressing barriers. You know, what is program eligibility? It's a lot easier. I mean, these funders, you know, these agencies seem to think that what services they provide is a secret to the people they provide them to. and it's not. It's all a matter of public record when you get public funds, right? You know, that kind of stuff is, you know, what you're supposed to be, what the rules are for the program. Those are all people's rights. So, you know, one of the things we're doing is getting a guide, like what are the legal criteria for homeless services through the COC, right? What's the legal requirement for getting a rental here for, you know, if it's HADCO, or, you know, what is the legal requirement for someone at Compass to provide services according to your disability, right? Those are kinds of things that, you know, the entity should not be concerned about sharing information that people really have a right to know. And I think it would make it a lot easier for not just the people that need the service, but anyone who's trying to help them. It would also, you know, help dramatically with access. Um, and I think about a conversation I had, you know, just last week with UCAN's Homeless Outreach about what basic needs they had, and it was over the phone, and the woman said she couldn't tell me over the phone. Well, why couldn't you tell me that over the phone? You know, those are kind of access barriers that make no sense, you know. And so, you know, and I understand what you're saying. A center would be great, but when I do outreach, I have a backpack and a pen and a clipboard, okay? And I have feet.
Right.
So, and when
No,
Martha does it, she has a wheelchair. So, you know, we don't need a building to make us better,
well,
right?
but the navigation center is more than just that. I agree with you. You wanted those outreach workers who are out in the field doing, but the navigation center would also have showers, would also have laundry
Yeah.
facilities, also have a lot of the other things that we've talked about that people need in order to be able to really move themselves out of homelessness. So looking at it's a broader brush than just a building for people to go to. It's something that really provides real meaningful services and could also provide as, you know, a place to get, you know, meals and food and whatever else they need.
Oh, yes. And we've talked about this before, you know, they used to call them drop-in centers, you know, and we talked about how that could, you know, have all the agencies together and help, increase access to services
Exactly.
and collaboration. Yes. And I'm all for that, but we don't need to wait for the millions of dollars
No,
is
I
what
agree.
I'm saying.
I agree.
We can do better here, and we need to have the people that are getting money do better here.
Yep, I
And
agree.
and in watching and this is really what kind of spurred us to do this now, is watching, what's happening with the city council. And part of that, when I was listening to all the services, the mental health services, and the drug treatment services, I was thinking those might be all well and good for other folks, but I don't see them benefiting chronically homeless folks very much. Right? There's major access barriers to those services. They're not engaged in the community. I think that with South River Clinic, they've done better by having their homeless outreach, but that's not really, the mental health professionals out there. And I know they have a crisis intervention team, but I'm not talking about crisis intervention, right? It's more than that. And those are things that we can, as a community, kind of press upon the people that get money on our behalf to serve these people, maybe start doing those things. So when we look at services, the one thing kind of glaring about this report that's up on the page is really people say what great services we have, but I think you can see here, we don't really have much of anything. Besides a rescue mission, we don't even have a place where someone can eat 5 days a week. That's the reality of if you're living on the streets. We don't have, we had a discussion today whether there were still 3 toilets downtown. And I don't know, Mike, did they remove one of the toilets? Do you know? Somebody said they moved one of the toilets.
Don't know that one.
Yeah.
I'll go look tomorrow and see. I know where they're supposed to be.
So they still at least have 2 toilets, but that's all they have, right? I mean, and these, and I agree that, you need a shelter alternative to the rescue mission, but wouldn't that suffice right now if it were just safe ground for people to stay so they wouldn't be moved around, where services could come to them?
That would work too. I think that's another option, another tool in the toolbox that we probably need. Yeah. And again, that's what I'm hoping to, if we had a commission and committee working on this collectively, we could look at that and say, here's another thing that we need. But yeah, I think that's another alternative option, because some people are, even the low barrier shelter isn't going to be right for them. Some people are going to need that transition from the outdoors and the indoors.
Right, and I think that, just having a safe place for them to stay, that they're not being harassed, where they have toilets, sanitation facilities, that actually makes them more able to access services, it gives some stability to them. I can't imagine the torture of not ever getting a decent night's rest. So does anybody have any questions or comments? Anybody in the Facebook chat have a question they want anyone to answer, or they want to make a comment? You don't have to just ask us a question.
Well, I'd like to talk about the city council presentation, and I watched it several times, and UCAN specifically focused on the dire need, but they gave very little information as to how they're spending their money and who they're helping and in what way. It's sort of like, well, they helped 23 chronically homeless in Roseburg, but how? Did they get them housing? Was it, what level of services? And when we have 845 people who are individuals who are homeless, according to the PIT count in January, I didn't see a lot of information coming about helping, just how bad it is. Anybody have any thoughts on that? I mean, did it look like that to you, to anyone? It was infuriating for me because I didn't see what we're doing about it and what solutions are. We could talk coordinating services, but
the part of,
you know, the vet, homeless vet women that two houses were built for, that case management fell through, but you know, there's other people who could come together, like the housing authority or like other people who could have stepped in, and I just don't see that kind of collaboration happening and talking about what they are doing, just how bad it is.
to respond to the city council presentations, it was a very restricted kind of um, uh, venue for us as speakers, because the city gave us first of all, gave us a 20-minute limit, and they were very strict about it. They were timing us on it. But then they gave us 3 specific questions to respond to. And none of the questions had anything to do with solutions. They just wanted information about the agencies. So that meeting was pretty much just an information collecting meeting. My sense is the next one's probably going to be more of that. They're really not looking at getting to the solutions idea section later on in the meeting, like the 3rd or the 4th meeting. And so I've heard several people say, I didn't hear any solutions. Well, we specifically were not asked for, and we were specifically asked certain questions, and that's what we were responding to. So it made it sort of limiting in what we could say.
Thank you. That was an enlightening response. Anybody else have anything to say about the city council meeting? Betsy, did you have any thoughts on that? I didn't get a chance to watch it.
No, I'm glad that the city council is actually even at this stage, but I am concerned that at least 2 of them have been involved on the city council for decades. And one at least was there when they wrote the prohibited camping ordinance, for example. That's the mayor. And so, you know, are they really looking for solutions? Because I just came across an email not too long ago that in 2012, I sent to all the city council, and that included now the current mayor, he was mayor then, and Bob Cotterell, who was on the city council at the time. And the mayor and the city manager at the time and the chief of police that was quoting the U.S. Interagency Council on Homelessness. This is a 1718 federal agency board that was, you know, convened, I think, in 1989 to study homelessness. And it's HUD, you know, healthcare, you know, all these different agencies that might any way, shape, or form have to do with anybody who's homeless. They have supported the Housing First model and recommended stop ticketing people and harassing them outside, provide them sanitation. This has been federal recommendation for decades now. Yet our city council, and they've had that. So I'm afraid that this is a way to keep people shut up, right? Analysis paralysis is what they call it. Right? We don't need to think too much about the solutions to homelessness. They've been thought out pretty well. We need to start doing. So, you know, I'm not against the commission because maybe it will lead to something. Maybe it will at least lead to accountability because Mike, you were there, you know, several years ago when the city council wanted to talk about homelessness and they were saying, how come nobody wants to sleep at the rescue mission, right? So this is progress.
It is progress. It's slow progress, but it is progress. I agree with you. You know, I'm a member of the Optimist Club, so I am an optimist by nature, and so I am guardedly optimistic that this will lead in a good direction. But I freely give you permission that a year or 2 from now, if it hasn't gone anywhere, just tell me I told you so. So.
Well, I hope that we actually go somewhere before 2 years from now, even. I mean, we
I
really
do
are,
too. I do too.
start moving in the direction of making policy that is based upon facts and evidence, not wishful thinking. I think that the unfortunate problem is people, the average person just wants homeless people gone out of their sight. Okay? If they just didn't have to see them, they probably really wouldn't care about where they were. But that is no longer the case, and so that pressure is there. And so, maybe time will cause that pressure, will cause that change. But I think that there's a lot of issues that needs to be addressed. And it's unfortunate that we didn't have, some folks that were interested, particularly on the mental health and the alcohol and drug side, because we know people who've had, shared personal experiences and frustrations of how to get help with folks. But, one of the things that, we don't have to wait for other people to come up with solutions, because that's kind of what this meeting is about, is see if we as a community can start to agree on things. Because the one thing that has been my years of experience that convinces bureaucrats and elected officials to do something different is when there's enough people demanding that they do.
Yeah, you were making the point I just wanted to make, which is the one thing we can do is, and what the city council members will be responsive to, is when the electorate, the people in the community, say to them, you need to be doing something. You need to be taking action. And if there's enough voters who are saying that to them, and I'm hearing more people saying that these days, that's what makes me a little more optimistic, is that, if enough people are saying that to them, most elected officials will listen and do it because they want to get reelected. So.
Yes, and we actually, interestingly enough, have a city council election. We elect our city councilors by wards. There's 4 wards in Roseburg if you live in Roseburg. And each ward has 2 representatives. And each one runs every even number of year. So they're divided up. So this term, right now, there's 4 of them are up for election. And the mayor, I believe he's got a 2-year term always. And so, that's the best time to actually have an impact on elected officials is around election time. Is around, but if they have somebody running against them, if they don't have anybody running against them, it doesn't matter much. But it is an opportune time if folks want to start talking to their local elected officials. But it also is election time for state and national office. I think that Merkley's is not someone you have to convince too much. He actually used to sit on the board that oversees the public housing. He used to be on that board at one point, but I don't know. You work for Gary Leaf. What is his? I've actually talked to Wyden's office about Wyden supporting a federal law that decriminalizes homelessness. So what is Gary Leaf? Do you have any idea what Gary Leaf might do in regard to, say, a homeless bill of rights to stop local jurisdictions from making it illegal for people to sleep outside?
Offhand, I do not. I've not talked to him about that, but Representative Leaf has been very supportive of homeless issues and wanting to do things. That's why he's, let me try to get the funding for the engagement center, and that's why he hired me. I mean, he offered me the position working as a legislative assistant specifically on housing, homelessness, and behavioral health issues. So, he's got a real commitment to the topic. He's putting his money where his mouth is and hiring staff to work on it. But on any specific legislation or any specific idea, we just need to run it by him and see what he says. So, yeah, I think he'll be in the details. But Representative Leif Gary is very, very interested in this topic and really wants to make a difference, see something done.
And he's up for re-election right now, too.
Yes, he is.
Yeah. And so is Dallas Hurd. So we have local representatives, and I think we have some over on the coast that are up for re-election. So that's a good time to start talking to politicians, because at least they will make promises. Maybe. So do we have anybody who has anything else to say, wants to make a comment?
I just want to say, thanks everyone for joining, and I really had an eye-opening experience talking to you, Mike. Thanks for all the information. Great talk.
Sure,
Thank you.
I just want to wrap up by saying that all of these programs and services, there is accountability we as the citizens do have, because they are taxpayer funded programs primarily that we are talking about. There is accountability at, possibly local, like let's say the housing authority, that's a local public entity. So if there's an issue with housing accessibility and accountability, there's a local entity. Then if you don't like what they say, HUD oversees them. So there's that federal oversight. Other agencies may have the involvement of the state, that the funding comes from the feds to the state. An example might be some of the funding for housing through Oregon Housing and Community Services. So there's federal funds that go to the state to distribute. So you have those levels of accountability. And so if you don't like what happens at a local level, there's pretty much always a boss. And ultimately, if they are in fact a federal agency and they're not doing their job, or even the housing authority who gets money from a federal agency, you can go to your senators and congressmen and ask them for assistance in addressing the problem. And they don't have direct oversight, like your senator can't tell the housing authority what to do. But I've seen bureaucrats like that run to keep a senator happy. Okay, so, there's accountability through those avenues that every citizen has. Doesn't matter who you are. You don't have to have a special name to be a pain in the rear and get their attention.
Don't we know it, Betsy? Don't we know it?
I'd like to say that we need to have more people's town hall and maybe focus on different specifics like decriminalization or mental health issues or the lack of affordable housing and nobody can afford the regular rental market anywhere. And we have to do something about these types of things and work on solutions. And I think that more people's town halls to tackle each of these issues, we can come up with a strategy of who we're going to go collaborate with or encourage their movement on solutions to all the number of people who are desperately mentally ill, who need supportive services to get housed, to stay housed. We need more people's town halls focused on specific topics.
Agreed. Much agreed.
Well, I don't know that dialogue has happened here, but because of the Black Lives Matter movement and the call for reform, and they call it defunding police, but it's really the reprioritization of local budgets to look at, instead of having the police, we don't see the Black Lives Matter issue here. You are going to be harassed and probably inappropriately treated by the police, more likely if you're homeless in Douglas County than you're a person of color. So, the problem is that when you're homeless, a lot of the homeless are actually become a police matter. So I think that when you look at the local city budget, you can say, wait a second, your budget priorities, how much tax dollars are we spending in the police addressing mental health issues? drug addiction issues. How many times, and we've never seen a dollar accounting. So one thing maybe we really should do is start to ask the city of Roseburg to give us that real functional accounting of how much, you know, the municipal court, because I don't go to the municipal court often, but the times that I have been there, 99% of the people who are in the municipal court are homeless. They are there because they are homeless. They may have been ticketed for something that doesn't say they're homeless, but it probably wouldn't have happened had they not been homeless. You know, they wouldn't have been there. So if we look at even what our municipal court is spending, what we're spending for that approach, we could probably reprioritize even some street level outreach workers that might make a world of difference, even in the criminality that we see. And that's true no matter what city you live in. And what I explained about how these programs work, it doesn't matter if you're here, it doesn't matter if you're in Lane County, Multnomah County, doesn't matter if you're in Los Angeles County, because these federal dollars are there, and every person who gets served by these programs has legal due process rights and other rights within those programs. They all have grievance procedures. They all, you know, some of them have appeal procedures for denial of services. You know, some can even go to court when a service is denied. So there actually are things that if advocates, if people started actually working one-on-one with agencies who were kind of not responsive, they could in fact help people exercise those due process rights and not only facilitate change for one person they're helping, but for other people once those agencies. And one other thing I want to lastly say, there is none of the services mentioned, you know, homeless services, services for folks who are homeless also include the advocacy, like the advocacy that Housing First Umpqua does, but also the legal advocacy that our local legal aid office does. And given their more recent interest and uptake in trying to actually facilitate solving problems on behalf of folks who are homeless, that is actually maybe a more important resource for our homeless community now when they're having problems, you know, accessing services, getting their rights honored, those kinds of things. So that actually can be they can be a very important service to folks who are homeless if folks who are homeless actually utilize them. And it comes from my experience of working for legal aid 20 years ago, and the kinds of things that legal aid really can help homeless and low income people get equality on. So anyway, there's my soapbox for the night.
Well, I guess in closing, we'll just say thanks everyone for joining, and we hope to have more of these. So if you're interested and you want to send us your topic of discussion, just message us on Facebook or contact us through our website, housingfirstumpqua.org. Bye all.
Yes, thank you.
Thanks, everyone. Bye.
Great, thank you.
Yeah, thanks, Mike.
Yes, you're welcome.